comes and presents themselves here, and then we're called in to come in and grab the clients over here, because it's quite a little bit of a labyrinth in the whole building, the way it's set up. So we have Sylvie that's here, one of our receptionists, and without them, we wouldn't be able to do our job efficiently, so thank you very much. Okay, and now this is the main part of this is where the majority of the people come for medical services. So we're going to go through the hallway here. And just before we go in, just to let you know, we've got between both centers, because we have this site, which is the Welland site. We also have a Hamilton site, and we have among both sites the stats are 4.4 doctors, and we have about 5,000 patients right now registered with us. And in terms of the medical services, we see over 20,000 clients that walk in or on appointments, and with all the other services, we must see about 24,000 clients a year. So that's including all the different services. So you have services in counseling, you've got services in immigration, you have health promotion, and then you have the medical services. We also have another department that actually consults. Consults with the Citizenship and Immigration Canada to instill or to make sure French services are offered just as much as there are English services.
You have a dietitian, chiropodist, nurses?
We have dietitians, we have nurses that, I can never remember their name.
Practitioners?
Practitioners?
We have the practitioners, but the one for the feet.
Chiropodist.
That's it. We have that.
There you are.
We've got
There you are.
Thank you. We got a lab.
Yes,
Are you sure they're nurses trained to do foot care, or they're...
No, she's a nurse.
Okay.
She's
so it's foot care trained.
Foot care.
Yes, foot care. Yes, it is.
Yeah.
And then we've got our lab, and we've got we got 2 doctors here. Like I said, we got 4.4 doctors among both of the sites.
How many nurse practitioners?
1.
Just one?
Or yeah, there's 1. Yes.
You know what? There's only five francophone nurse practitioners in Southern Ontario.
Wow.
So, like, I mean, you know, like they're harder to get than doctors.
Yeah.
And I'll tell you something. It's harder to get a fully trained francophone bilingual medical secretary, okay, than a doctor.
Yeah, I can imagine.
Like, I mean, there's some skills that are just so hard to find.
Yeah.
You know, like we're into these programs where we're growing our own in a lot of these kinds of things, where we basically take underfill and really develop and encourage professional development in every way possible to make sure that we've got the skill sets that we need.
How do you manage between the 2 sites? Like, what is your management structure for your sites at such a distance?
There's 1 executive director, and I've got 5 program directors that work under me. Like one that takes care of primary care, one takes care of all the counseling services. Yeah, and so basically we cover both sites, okay?
You rotate.
Yeah, and what happens is that we have a lot of workers though that also travel between 2 sites to do services in both sites, and we also were the first center that started the whole video conferencing thing to join the 2 pieces or to join the 2 points of service and really do a lot of staff meetings and a lot of consultations. And yeah, and for us, like Ontario Medicine, for example, is a very, very important piece, because like to do consults for psychiatric services and everything else with Montfort in Ottawa is becoming very, very, very important to us. Like,
And you do that by video?
Yeah, but we've joined the Ontario Medicine, the Telemedicine Network to get on, but we were doing it before that even came along.
Yeah.
Because like it's just that was a thing that we needed to do to get the proper resources that we needed, like, you know, and we needed to bring the 2 sites closer together, so video conferencing for us was the only way to go. And so, like, you'll see our center down at the end, like, you know, but it's going, I'll tell you, pretty well full blast all week.
Yeah.
Do you have like a newsletter or an annual report that you can share with us?
Yeah, I don't know if they put them in the, if not, you know what, we'll get them to you tomorrow, but we've got, problem is, though, the annual reports are all in French.
It's okay,
We'll get them out.
Some people can read it.
Okay, we've got to keep on though.
So we're gonna enter into the medical department. Again, just to go on with some of our services, we have nurses that go into the homes to do lab, to do checkups. Again, we have our lab. We have a small lab over here as well that we do follow up on those kind of analyses and stuff like that. So, and we have a lot of seniors, so that's why we were able to develop the in-home services so that they don't have to come here, and we're actually going into an environment that they feel, that they're staying in their environment that they feel comfortable in. So let's go on here. I think we still have some, there might be some patients, so we're just gonna go quietly, but we'd like to show you where we operate. So the reception, we've got files, that's our file office. Here. This is the lab. Come on this way. These are our offices. Health promotion over here. Hello, Razwa. Dietitian, nutritionist. So we have a lot of services. It's a lot. All right, we're gonna go this way. All right, we'll stop just around here. We'll just stop around here. We'll wait till everybody comes through. So also with the medical services, I forgot to explain, we have nutritionists, dietitians, they have groups for diabetes, we have for just health promotion in general, a whole gamut of services. I know myself, we actually designed a workshop with the nutritionist, the dietitian, to look at what is everyday healthy living. And we did a visit to the grocery store, we did a day of cooking healthy for a lot of, most of my clients are refugees, and they have a hard time trying to figure out what kind of foods to make. Here with the different types of legumes and all that kind of stuff. So it was really good. We're a very dynamic group. This is the family corner, and we have services every morning and twice a week. They also do community suppers every second Tuesday. Yeah. Very festive. Yeah, it's really nice. And we got programs in the summer, anything.
Oh, so this is like the children's chamber.
Now we're entering into les services sociaux and social services. So you have your counseling. You have counseling on this side.
You can all run over for.
Right now, the French-speaking refugees are from Haiti and Congo and Rwanda. So that's the majority of it. So on the one side, you've got a little bit of everything. We've got some of the health promotion over there. We've got HR. We've got computers or techie. We've got also some counseling, services for families and young people. So we're sharing a little bit of the space. Over here is basically your gamut of all counseling. I have a little office here for settlement services and immigration services, and that's basically this little corner over here. Okay, and if you're looking, like as you're walking through, just visualize what we have about 8,000 square miles, 8,000 square feet. The building we're building, we have a little mock-up that's in the conference room. We're going into a building at 22,000 square feet.
For the same staff complement?
Right now, yes, for the same staff, because we're actually working on top of each other right now. So yes, we even have storage in our own rooms because there's not enough storage for.
Complement?
Pardon?
What is your current staff complement?
Oh, that's a really good. I think we're about 70, 75. Okay.
75, eh?
Yeah, both sites. Both sites.
Oh, right, both sites.
Both
On
sides.
this site then?
I think there's about 28 people staffed here, so the majority is at the other place. We've got 3 levels at the other place, but again, over here, it's only 8,000
Yep.
square feet. We're going into something at 22,000 square feet, so we're really looking forward to it. All the space, good counseling rooms and
We're
everything
looking
like
at
that.
about the same size space
Yeah.
at our capital request for the same staff.